Okay, hi, my name is Dr. Đăng. I am a medical student, and in this presentation, I will talk about gastroesophageal reflux disease, or GERD for short. Okay, so there are 8 main parts in my presentation. They are definitions, causes, diagnosis, symptoms, treatments, risk factors, complications, and summary in their respective order. Firstly, we'll talk about the definitions. The first one is the acid reflux. It happens when the contents from the stomach move up into the esophagus, as you can see here, and it's also called gastroesophageal reflux. If you have symptoms of acid reflux more than twice a week, then you might have a condition known as gastroesophageal reflux disease, or GERD. And according to the National Institute of Diabetes and Digestive and Kidney Disease (NIDK), GERD affects about 10% of people in the United States, and if left untreated, it can sometimes cause serious complications. So what is or are the causes of GERD? The main cause is the dysfunction of this sphincter. It's called the lower esophageal sphincter, or LES. It is a circular band of muscle at the end of the esophagus. While it's working properly, it relaxes and opens when we swallow. We swallow food here, and it opens, and the food went to the stomach. And after that, the food went to the stomach, it tightens and closes again afterwards, so the contents, the acid in the food won't come up like this. So the acid reflux happens when the lower esophageal sphincter doesn't work properly. It allows the digestive juices and other contents from the stomach to rise up into the esophagus. Okay, now let's look into how doctors diagnose GERD. If your doctor suspects you have GERD, they will conduct a physical exam and ask about any symptoms you've been experiencing. They might use one or more procedures to confirm a diagnosis or check for complications. For example, this barium swallow. It involves the using of an X-ray machine and a contrast agent. After drinking barium sulfate, which is a contrast agent, X-ray imaging is used to examine the upper digestive tract. Like in this image here, if you have GERD, you will see the lower end of the esophagus. The image is really white. The next one is the upper endoscopy. It involves a flexible tube with a tiny camera on the other end. It is threaded into the esophagus and to examine the upper digestive tract and even collect a sample of tissue when needed. Another way to diagnose is esophageal manometry, which involves a flexible tube again, but this time it don't have a camera on the other end, and it also threaded into the esophagus to measure the strength of the esophageal muscles, especially the lower esophageal sphincter or less. Last but not least, we have the esophageal pH monitoring. They involves the using of the monitoring device. Literally on the name, okay, and a monitor here is inserted into the esophagus to learn if and when the stomach acid enters the esophagus, and it's recorded here in their monitoring device. We have seen how doctors diagnose GERD. Now let's dive into the symptoms. The most common symptom of GERD is heartburn. It feels like burning chest pain that starts behind the breastbone and moves upward into the neck and throat. It's basically acid indigestion. Many people say it feels like food is coming down into the mouth, which leaves an acid or bitter taste. The burning can last as long as 2 hours, and it often worse after eating. Lying down or bending over can also result in heartburn. Besides, you can also have nausea, bad breath, breathing problems, dysphagia, and vomiting. Especially if you have acid reflux at night. You may also have chronic cough, rhinitis, asthma, and sleep problems. Okay, so what are the treatments for GERD? To prevent and relieve the symptoms of GERD, you might be encouraged to make changes to your eating habits or other behaviors. Doctors might also suggest taking medications, especially over-the-counter medications such as antacids, H2 blockers, or proton pump inhibitors or PPIs. But keep in mind that these medications can also cause side effects such as headache, constipation, diarrhea, nausea, and vomiting. And let's move into surgery. Yes, in most cases, lifestyle changes and medication are sufficient to prevent and relieve symptoms of GERD, but if they haven't, surgery is needed. Surgery also needed if the patient has developed complications of GERD. There are multiple types of surgery available to treat GERD, including fundoplication. This surgery involves the wrapping of the fundus around the backside of the esophagus, and the graft is secured with sutures to anchor the esophagus below the diaphragm, and also adding some power to the lower esophageal sphincter, which stops the acid from entering the esophagus. The next procedure is the Transodo Incisionless fundoplication, or TAF for short. It has the same principle as the normal fundoplication, which is the wrapping of a fundus around the esophagus, but it don't need to make a hole into the body, and the device is inserted into the esophagus through mouth. The next one is the strata procedure. It involves putting a device through the mouth and into the esophagus, and this device treats the muscle with radio frequency imaging, and in order to make the muscle thicker, in this case LES thicker, which prevents reflux. And the last one is the Lynx surgery. This surgery uses a Lynx system which has magnets in it, nasal retraction, in order to assist in the closing and opening of the esophagus. It also, as it stops the acid reflux. Apart from medication and surgery, there are several lifestyle changes and home remedies that may help relieve GERD symptoms. For example, it really helps to quit smoking. Smoking is really bad. Please don't do it. It affects lots of people. Not only that, you can also lose weight, eat smaller meals, avoid lying down while eating, and avoid foods and drinks that trigger symptoms. And some herbal remedies can also provide relief. The most commonly used one are chamomile, licorice root, marshmallow root, and strawberry elm. Although more research is needed, some people report that they experience relief from acid reflux after taking supplements, tinctures, or teas that contain these herbs. But in some cases, herbal remedies can also cause side effects and interacting with certain medications. So checking with a doctor before use is really recommended. Okay, now let's look at the risk factors. A certain condition can increase the chance of developing GERD, including obesity, pregnancy, hiatal hernia, and connective tissue disorders. Some lifestyle behaviors can also raise the chance of developing GERD, including smoking, eating large meals, lying down or going to sleep shortly after eating certain types of foods such as deep fried or spicy foods, drinking certain types of beverages such as soda, coffee, or even alcohol. Known that using non-steroid anti-inflammatory drugs, NSAIDs for short, such as aspirin or ibuprofen, can also raise the risk of GERD. Now we are moving on to potential complications. In most people, GERD doesn't cause serious complications, but in rare cases it can lead to serious or even life-threatening health problems. Potential complications of GERD include esophagitis, which means the inflammation of the esophageal wall. Esophageal reflux may cause peptic esophagitis. Another one is esophageal stricture. It happens when the esophagus narrows or tightens. Chronic inflammation may result in esophageal stricture and shortening. Now on to the more serious side of the complications. The first one I'll talk about is the Barrett's esophagus, which happens when the esophagus lining changes permanently. As you can see here is the normal lining and this is the abnormal lining. You can also see here too. Normal lining is like really smooth and kind of flat, and the Barrett's esophagus is more like the lining of the stomach. And next one is the esophageal cancer, which only affects a small portion of people with Barrett's esophagus. And here, if the Barrett's esophagus worse, it can lead to cancer because of the dysphagia and neophagia. Other complications are asthma, chronic cough, or other breathing problems, which may develop if you breathe stomach acids into the lung. As you can see here, in the asthmatic lung, the bronchial tubes more constricted, with the muscle tightens and the lining is swollen. Additional amount of milk is also made, so it's really difficult to breathe. It can feel like you have to breathe through a straw. And not only that, you can also have the tooth enamel erosion, gum disease, or other dental problems. So in conclusion, gastroesophageal reflux disease, or GERD, is a common clinical problem caused by the malfunction of the lower esophageal sphincter, or LES, and certain people are more susceptible than others. The most common symptom of GERD is heartburn, and early recognition of symptoms is integral to preventing complications of GERD. There are many treatment options, but behavioral changes and medication still play an integral role in treating GERD. Okay, and the material in this presentation is based on the following resources. Yeah, there are 6 in total. And that's it for my presentation. Thank you for your attention, and if you have any questions, you can ask me through this email, and have a nice day.